think that nutrition is the foundation. So now I'm going to talk briefly about the body systems. And we know that in PANS we have disruption of the neurologic system. That's usually the symptomatology that brings the children, in to be evaluated and treated. And it's immunological, because it's an autoimmune or a misdirected immune response. And then the other body system that I was so happy to hear Dr. Cooperstock talk about was the gastrointestinal, or the gut system. So and I think this is an important concept for parents and for practitioners. The neurologic system does not work in isolation. The immune system doesn't work in isolation. They're both part of that intricate feedback system with the gut and with the gut microbiome I'll get to in a minute. So I think that addressing all three of these symptoms can really help our kids improve and heal. And so this is a slide I like, which is very similar to the one Dr. Cooperstock had, except for patients who know me, you can see in the middle, there's the microbiota, one of my areas of questioning all the time. I need to know what's happening in the body. And so you can just see that there's connections, they're all interconnected, and in the middle is the microbiota. And I'll talk more about that in a minute. And this is just briefly to give you an overview. I know you've heard so much detailed information, but this is kind of just a foundation, at least that's what I'm trying for. So the immune system, it's a highly complex system. It turns on via a cascade system. That means you turn one switch on, and that turns on 2 switches, and then 4, or maybe 1, 10, 100, 1,000, 10,000, and before you know it, you're at 1,000,000. So when you turn it on, it works that way because it has to defend us, and you want it, responding right away. But when it's a misdirected response, and it happens and turns on all over the place, it can be really difficult to deal with. It turns off via a feedback system, and as Dr. Cunningham talked about earlier, sometimes that feedback system gets disrupted as part of the illness, and that's really the challenge of trying to get the immune system to return to a normal function. So when I think about the immune system, and when I learned all about the immune system, the first thing that the immune system has to figure out, because it defends us against the environment, if you will, what is self and what is non-self. And when that's mixed up, you have autoimmunity. It also has to determine in the environment what's dangerous and what isn't dangerous. If the immune system identifies something as dangerous that isn't, like pollen or peanuts or dog dander, then you have allergies. And then you have to have the immune system be regulated, and if that gets disrupted, then you have what we refer to as chronic inflammation. So, and Dr. Cunningham touched on this during the Q&A, but you have multiple lines of attack. And so, and the regulatory cells are called, or molecules are called cytokines, and we know that in our kids, this system gets very, very disrupted. And I'm mentioning these briefly because later when I tell you about some of the testing I do, I want you to understand that we look at different antibodies for different things. So antibodies are one part of the immune system. I think of it as like a military force. And you've got, the Army, the Air Force, the Marines, and the Navy. And so we have IgA, IgM, IgG, and IgE. And I just listed there that they work in different places. And largely the IgA is in your mucous membranes, which is from the tip of your nose to the end of your GI tract. You don't think of it, I never used to think of it this way, but that's the part of your body that's in contact with the outside world. And so it's important that it's defended, especially. And then IgM, usually for new infections, IgG, which is what we measure a lot in our kids. And then IgE, you see often in allergy and in parasitic infection. So this we already talked about. Just one of the, I guess, revisited discoveries on the immune system, that the lymphatics go right up into the brain. But I think that this is important, and I included it because it's exciting, and I think it's going to offer a research opportunity for mechanisms for autoimmune disorders that cause neurologic function, but also, they have to change all the medical textbooks, because based on centuries of dissection, we understood that the lymphatics didn't go into the brain, and yet we just discovered that they do. And I think that should make all of us remember that even when we think we understand something, we might not fully, and so we all have to have an open mind and help educate one another. Okay, the gut. This is where all that nutrition, ingestion, digestion, absorption, transport, assimilation, and excretion all happen. And some people call the gut the second brain. and for reasons Dr. Cooperstock mentioned earlier. So when the gut's not working right, you can have appetite disturbances, weight loss, weight gain, mood changes, and it's where the microbiome lives. And the microbiome is the ecological community of commensal, symbiotic, and pathogenic microorganisms that literally share our body space. And I think this is an important concept too, or at least one that I try to bear in mind during practice. Commensal means it lives there, and it doesn't hurt you, but it might not really be helping you. Symbiotic means it benefits and you benefit, and then pathogenic means it's causing a disease. But we know this for lots of other reasons in the body when it comes to organisms. A commensal organism, if it overgrows, like a vaginal yeast infection, for example, it causes disease. And so when your microbiome gets disrupted, even organisms that normally are there not causing a problem can then start to cause a problem, and that's why I think it's important to look there. And again, Dr. Cooperstock mentioned some of this, but I mean, just to put it in perspective, a healthy adult gut has about 3 pounds of microbiota in it. It has a major impact on our health, but our choices have a major impact on its health. So it's something that we can help. And when it gets out of balance, then you have an imbalance of the microbiota. One term that people use sometimes is dysbiosis. And when the gut is off and the microbiota is imbalanced, some of the things that you can see are actual metabolites that come from the organisms. Clostridia, for instance, is one of them, that can release a chemical, an acid actually, that can really be toxic to neurologic function. And in a mouse model, they've taken this and injected it into mice and really disrupted their behavior. And it can interfere with your neurotransmitter production because, the chemicals that help our brain work, our dopamine and everything, a lot of them are manufactured in the intestine. And when your gut's off and your microbiota is off, you can have hyperactivity, sensory and mood problems just from the gut disturbances. You also can have allergies and sensitivities. And if you have an inflamed gut, sometimes you experience skin rashes, joint pain, and fatigue. So, and obviously our kids sometimes have abdominal symptoms. So this is just an image that kind of recaps what I said, but it's a very important system. And so it's one of the places that I look. And actually, to talk about the foundation, when I first, people come in and they're having neurologic and immunological problems and a lot of behavior problems, and I start asking them about, their poop and how often they do, and they're just like, where are you going with this? Well, I feel, the foundations for healing, the first thing you have to do is get that microbiome, get that gut function, that second brain, as healthy as you possibly can. And a reason that I look here, this is something that we can accomplish. The gut, the first 3 steps. And then the first 3 steps to healing the gut is real food, real food, real food. And I already talked about the recommendations. One of the things about avoiding sugar, though, is that sugar has low nutritional value. I mean, it's a celebratory food. I'm not anti-sugar. It's to be enjoyed in small amounts. It has very limited nutritional value. You're not going to get nutrients and vitamins and minerals that you need when you eat sugar. It's inflammatory to the immune system. And I try to remind my patients that microorganisms, they use sugar for fuel. We can use sugar and fat and protein. So we want to feed our body nutrients that fuel us and don't overfeed our microbiome. Some of the things I look at is, when I'm looking at the gut, is food sensitivity. And it's different from a food allergy. I measure the IgG in some patients where food allergy is IgE, but I do that testing as well. And it's different from celiac, which is a gluten allergy, but it's the IgA antibody. And so the test that I do can tell me a lot about the health of the gut. I'll tell you in PANS, and a lot of this work I started to learn about in taking care of my children with autism, but I'll tell you I see very, very similar findings in our kids with PANS, and they're both really neuroimmunological disorders, so it's not surprising. But gluten, casein, and soy are often foods that children are sensitive to. And I often see findings that tell me that the gut lining is not working like it's supposed to. I also do stool testing, which looks at digestion, absorption, inflammation. It looks at the intestinal microbiome. And I see over and over again in our kids that they have findings that show that they're not having proper digestion, which, and Dr. Cooperstock hit on this earlier, but So some of what our microbiota does is their presence is necessary to make the enzymes that we need to digest our food. So if we don't have the right complement of the bacteria that's supposed to do that, we're not going to make enzymes for us to properly digest our food. And then this undigested food sits around, and then who gets to feast on it? The bacteria. And so then the imbalance gets even more profound. And then often I will see bacterial infections. Certain bacteria is expected in the stool, but certain bacteria isn't. And so there's certain germs I'll see that are growing and need to be treated. And again, fungus is allowed in the intestinal tract. It belongs in the intestinal tract just like it does in the vaginal tract. But if it overgrows and you don't have presence of the normal healthy bacteria that should be there, then that needs to be addressed and treated, and I do that. So what we think about when we're trying to heal the gut, the 4 R's: you remove, you repair, you restore, and you replace. So I ask the patient to remove food allergens. Now, I know that at least 50% of our kids have real problems with feeding, and I will repeat that we have to make sure that they eat. So there may be individuals that this isn't going to work right off the bat for, but it is a goal. But you want to remove food allergens. Often it's temporary, just for a period of time, until you can get the gut to heal. And I've seen this time and again in both my, in many of my patients, adults included. When we remove a food that the person is sensitive to, not what we would think of as a true IgE allergy, but they're sensitive to, within 4 to 6 weeks, sometimes 10 or 12, I have had patients where their asthma goes away completely. They're off of all of their inhalers, all of their inhaled steroids. Their eczema goes away. So, you know that food is affecting the immune system in some way. When that food goes away, the immune system symptoms go away. And I already talked about trying to eat a clean diet that's as free of chemicals as you can get, and then to appropriately treat appropriately diagnosed infections. And then repair. So the clean diet, and then I usually use essential fatty acids, antioxidants like vitamin A, C, and E, anti-inflammatories. And it's interesting because, these are herbal, or food, if you will, but they do have some research behind them and some nice studies, mostly from Europe, because they use them a lot more and study them a lot more. But curcumin, it was mentioned yesterday, curcumin is one of my favorites, and actually it was pretty widely studied in the oncology world, because they discovered a while ago that it was a very potent immune modulator. And what I like about this is it's really safe, but it's really effective. And then quercetin, and these are just some products that I use, just for your reference, but aloe vera, L-glutamine, and zinc and magnesium. And of course this would be based on an individual's testing. Then you want to restore the beneficial bacteria, so you want to do that on a daily basis. And especially for our kids, and Dr. Murphy talked about this, but a lot of our children who have to be on long-term antibiotics, you do want to reintroduce healthy bacteria to try to ensure that you're keeping a balanced microbiome. And so she mentioned Florastor, which is Saccharomyces boulardii, which is one that I really like, and that has been shown to prevent C. diff and to help in healing from C. diff. 2 strains, that's a friendly yeast, by the way. 2 strains that I like to use are Lactobacilli and Bifidobacterium. And then you want to make sure that it's an adequate dose. And then in pans, I usually do start low and slow with the probiotic, because I find that even the introduction of healthy bacteria can kind of tweak the immune system a little bit, but it's only a couple of weeks before you can get them up to a dose that seems appropriate and is well tolerated. One of my favorite things to recommend, though, for keeping a healthy gut is to actually use fermented foods. And fermented foods are, foods that have naturally occurring bacteria in them. And people have done this for a long time, and every culture has some form of fermented foods, but I think in our modern world, we've kind of gotten away from them. You can buy cod liver oil that's fermented and actually tastes pretty good. Sauerkraut juice, kefir, which Dr. Murphy mentioned a recent paper, yogurt, beet kvass, miso, and there's a great book that I noted there by Sally Fallon with a lot of great recipes for this and for just real food. I replace digestive enzymes at the beginning of treatment. I mean, the goal is that you're going to fix the gut and have the right complement of bacteria so that they're doing it on their own, but in the meantime, I find that enzymes very helpful, and then you want to make sure that you're giving minerals, and those are pretty easy to do. And then immune system healing, I like to look for allergies, and I think most docs do. You know, if you already know you have a child whose immune system is under complete stress, if they also have allergy in the environment and you can control it, then you want to try to do that. So if a child hasn't been tested for environmental and food allergies, I usually do that as part of the first visit. Because I think of it as any way, you know, we can't control what happened with the strep. We can't control the misdirected immune response that happened from that infection, but I think that we should try to control the things that we can control. And so if we identify allergies, we can take those allergen foods out, and we can try to manage the environment so that the child's getting the least immune activation from environmental allergens. I also test for other autoimmune problems, celiac, thyroid. I don't see tons of it, but I do see some autoimmune thyroid disease, and CFD, which is an antibody that can be formed against the folate receptor that brings folate into the brain. That's more something that I look at in my children with autism, but I tested a few really severe children with PNs and found that present too. And the reason I do that is it's treatable. You just give appropriate doses of folic acid, which is B9, and they can have a nice clinical improvement. And I look at inflammation markers. And so you'll start to see, as I talk about the interventions, that they're similar. A clean diet, address the gut, but then treat the allergies. And I see a lot of kids, we do use allergy medicines sometimes for immune modulation in pandas, but I see some kids who just have rhinitis, and they've got immune, those blue shiners under their eyes, and they need Flonase, and they need, daily Zyrtec. We need to treat their environmental allergens, because that's just an additional stressor, as I mentioned, on their immune system. Some things you can avoid, maybe like a dog, but you're not going to avoid trees, so you need to be treated, in my opinion. And there's things you can do in the home, like HEPA filters and dust filters, and these special new filters that use an ionic technology and really can get rid of mold and other things. I think they're a good investment, because your child spends a lot of time in the house. And we already talked today in the Q&A about allergy shots. If you're able to do desensitization therapy and it can help, that I think is worth doing. This is just a quick graph, and I want to make sure I have enough time, so I'm not sure I'll get into that too much, but basically that graph shows a regression in symptoms with ADHD or autism is one of the lines, and the other line is pollen. So I think that and a lot of kids, it's spring and now he's flaring. So if we can preempt that and treat the allergies, I think we're doing them a favor. Again, we already talked about ibuprofen and histamines, and it's the recurring theme for me. A lot of the things that Mother Nature makes does more than one thing and helps all around. And then really a favorite of mine for an anti-inflammatory effect is bone broth. And I put a link there so you can see if you want to buy it. It's easy to make and easy to get a recipe. You have to make it taste good to get it in the kids, or hide it in their food, which is more likely the way that we do it. And if you do identify an autoimmune disorder, you obviously would treat it. And then, I already said, we're trying to get the immune system to calm down. I always like for people to try to go to the Environmental Working Group webpage and look at the products that they're using in their home. And it's overwhelming at first. You're just trying to deal with getting through the day, and I understand that. But there's chemicals that may be in the house and you don't realize it's just habit or advertising, brand loyalty, what you're used to, that may be further stressing your child's immune system. And it's not that you have to go and change everything at once, but maybe the next time you go to buy cleaner for the counter, you could pick one that was less chemical. My grandmother cleaned everything with vinegar, lemon juice, and bleach for tough jobs. And I think that was probably wiser than what we're doing now. And the other thing I just want to talk about is pesticides. Again, we don't know the full effect of pesticides on humans, and I know they're here, and I don't think they'll mind me sharing, but recently I had a patient just a couple of weeks ago, and they had an insect problem that needed to be addressed in their home. They had somebody come to spray, and within hours, their child was having a very dramatic flare of his ticks, and he had been virtually tick-free prior to this. I think the spray was at 8:30 or 9, and by 10:30 he was ticking like crazy. Now, we were able to get right on top of it with some anti-inflammatory therapy, and within a week he was 90% better. But I think that that is a good example of stressing out the immune system in a way that's completely preventable. And I felt badly that I hadn't told them before to try to avoid pesticides. And if it does have to happen, just have the child out of the house, do it on a Friday, see if they can stay with grandma overnight or something like that. But just to be mindful of it. I think that we're awash in chemicals that we take for granted. We put them on our skin, they're incorporated into our food, we spray them around, and I think that if we just stop for a minute, we can really make our environment less stressful for our immune system. And then, neurologic, treat the gut, treat the immune system. I was excited to hear Dr. Cooperstock talk about vitamin D too, which he already talked about, but it's an easy thing to fix, it's an easy thing to identify, and in my clinical practice, 100% of my children with autism have a low vitamin D. I haven't measured one yet that was normal, but in my kids with PANS that I measured on everybody, I'd say probably 60 to 70% have an actual low vitamin D, a vitamin D deficiency as defined by the Vitamin D Council, but I'd say 100% of them are suboptimal. So the goal, especially with developmental or neurological issues, would like to have them over 60 if possible. And of course, you need sun to get vitamin D to activate and work properly, and sometimes our kids don't want to go outside because of how they're feeling. And also, it's a fat-soluble vitamin, your gut has to be working to get it in. So I'll usually supplement that and then use a maintenance dose and monitor it at the beginning every 3 to 6 months and then annually. You still with me? It's a lot. So just briefly, this is cellular function. And I know that you've gotten so much detailed medical information, but I think it's just, I want to share this, and I'll be brief about it, but this is kind of the little machinery of how our body really works. It's tiny, you can't see it, but it's there and it's important. And so I'm going to briefly touch on mitochondrial function, methylation, and detoxification. So a mitochondria is a little part of the cell, which we normally call the power plant of the cell. And I put a picture there, it's a neuron, and it's got a lot of these mitochondria, because a neuron's a very complicated cell and it needs a lot of energy, and right, our kids are having problems in that area. And that's just a little blow up, and it shows you this fancy little reaction that happens that requires oxygen and water, and it makes our little energy molecule, it's called ATP. And I just put this up because, I don't know, before med school, I thought all these drawings and everything were like cartoons, like maybe that's what's in there, but no, it's actually in there. And this is what a real mitochondria looks like. And there are things that can damage mitochondrial function. Medications can do it. And you have to be careful. Acetaminophen does have a negative effect on mitochondria, which is why I usually recommend ibuprofen rather than, acetaminophen. Chemicals, toxins, heavy metals, and infection. When you see, and I'm not talking about mitochondrial disease, that's a different entity, and that's usually, identified by profound symptoms that a child has at a young age. But I'm talking about what happens to our kids at a biochemical level when they become sick with an illness like this, and how can we get in there and help them in the healing process. When you see mitochondrial dysfunction, you often see fatigue, low tone, low weight, slow growth, and then impaired immune and neurologic function. So it needs to be supported if we can, and if we do support it, then that can help in our healing process. I only put this up to show that fats, carbohydrates, proteins are what go into this fancy little cycle that happens in the mitochondria to put our energy out. Again, just the concept of real food. Okay, this methylation is stressful. I tried to find a friendly molecule for you, but basically, it's a little carbon with 3 hydrogens attached to it, and there's one empty space. So this little molecule bounces around and it turns things on and off in the cell. And this is where a lot of what's called epigenetics, it focuses on, and in many others, but basically, how do your genes work and how do they interact with the environment? And a process, this methylation is how we work, and some of our kids have problems with doing it efficiently. And that may not matter until you're sick. And maybe you wouldn't get as sick if your methylation was working properly. So methylation is dependent on vitamins, minerals, and proper nutrients. It's heavily dependent on the B vitamins, magnesium and zinc, and proper amounts of essential fatty acids, your omega-3, 6, and 9. It produces this really cool substance in our body called glutathione, which is our body's natural antioxidant, and it really helps us regulate ourselves. And I don't know what the numbers are for PANS, I'll have to be honest, but there's a couple of papers that show that about 80% of children with autism have low glutathione levels. And one of the recent papers I read showed that curcumin actually increases blood glutathione levels, which may be part of the benefit that you see when people take it. Okay, this was just to see if everybody was awake. That is the methylation cycle. And I'm not going to go through this at all, but I did, if my pointer works and my monovision lenses are working. So right here in the middle is where the process happens that is dependent on B12 and folic acid. And they're like little gears that turn. And this cycle over here is where your neurotransmitters get produced. And down at the bottom of the cycle is where your glutathione gets produced. And it uses energy. And that, all I wanted to show you was, it's complex. And everything depends on each other. And if you look throughout that diagram, the things that are circled are the necessary cofactors, and you see over and over again the B vitamins, zinc, and magnesium. When you do biochemical testing, you see that they're low in many of our children. It's such an easy thing to fix, so that's what I normally do. And detoxification, glutathione is involved in detoxification. It's basically how do we clean out all these things we're exposed to on a daily basis. It starts at the cellular level, then it goes through your GI system. So those are the systems we're trying to support. And I kind of already said this, but one of my big areas for detoxification is just try to not get exposed to the toxins if you can help it. You know, anything that goes on your skin, anything you're breathing, and anything you're eating. Try to make it as easy on your body as possible. There's tests I do to look at this. A regular metabolic profile, which is routine blood work and looking at your liver and kidneys. There's certain specialty tests I might use looking at urine metabolites, which can help me understand how those things are doing. There's a genetic test, it's called a SNP, it's inexpensive and easy to get. And then based on concerns I may have, if I'm worried about methylation, or I'm worried about mitochondrial function, or I'm worried about maybe environmental exposure or heavy metal exposure, then I'll get some specialty testing that I listed there. And then the treatments are for mitochondria, and you'll see the same thing over and over again, fatty acids, B vitamins, and then a few other, and this is from Kennedy Krieger, who's done a lot of work with mitochondrial dysfunction in kids with autism, and they're very safe, very straightforward supports like coenzyme Q10, L-carnitine, vitamin E, and vitamin C that sometimes clinically, when you put a child on a cocktail like this, you can see their energy improve in a matter of weeks. And kiddos who haven't been growing or moving or gaining weight start doing all those things, and it's very rewarding when you see that happen. So, homeostasis revisited. I already gave you all the concepts, but health is the ability to return to a state of homeostasis. And that is what we are trying to accomplish for our children. And you did hear so many stories of hope today that our kids can and do get better. And this information, I hope, is information that will help you to feel empowered to do other things for your children that can help as you're waiting for them to get better. So I appreciate your attention, and I'll take any questions if we have, I think, maybe 5 minutes left.